When is root canal necessary? So root canals are required when cavities start out small, and as they progress, they get deeper and deeper. If they get close to the nerve chamber or the pulp of the tooth, which is the center of the tooth, that's when a root canal is necessary. So, and a filling just won't cut it. What a root canal is removing the infection inside a tooth that's occurred already, or if the cavity is gone close enough to the nerve that there's irreversible damage to the nerve. So yes, it's better to come in for regular checkups and cleanings and exams so we can catch cavities early when they first start, because letting them progress to the point where the cavities are now into the nerve or the center of the tooth, and then suddenly that becomes root canal territory. Yes, root canals are necessary when you have throbbing pain in the tooth and the cavity has gone down to the center of the tooth, or you have an infection in the tooth. Those are both reasons why root canals need to be done. Signs and symptoms of root canals are if you ever get an abscess or a swelling around the tooth. You'd feel a swelling right around the gums of the tooth. That automatic sign. Another sign would be a throbbing pain that keeps you up at night, something that you have to take medication for, and pain that's there for several days and is not being relieved. So those are several signs that root canals are necessary. Another sign that people don't recognize is, and it actually involves no pain at all, is if you've ever had trauma in the past. Your tooth was hit by something, or there's a change of color in the tooth. When a tooth starts turning darker, it's becoming devitalized, and even though you may have not had any pain with the tooth, a change of color in the tooth, a graying or a purpling, does mean that the tooth is devitalizing and that it's becoming necrotic, the tooth is dying out, the nerve in the tooth is dying out, and that you may need a root canal on that. So root canals get a bad rep. It's maybe just a small percentage of root canals that do cause that pain. That's mainly when the tooth is you have an active abscess and the tooth's infected. But majority of root canals are actually pretty quick procedures, nothing more than a filling procedure. The freezing is the same. Our specialist who does our root canals mostly here, people are amazed at how quickly and they're done, and they come out saying that was a lot quicker than I thought it would be and much less painful than I thought it would be. There virtually shouldn't be any pain for a root canal. Root canals nowadays, very short appointments and very similar to just getting fillings done.